More than 45,000 people were killed in Turkey's devastating earthquake this year, but an exclusive investigation by DW's Turkish and Environmental Services has revealed that a looming health crisis in the region could lead to many more deaths. The quakes destroyed almost 300,000 buildings, many of which contained asbestos. The World Health Organization says exposure to even low levels of the mineral can lead to lung cancer. Local authorities have downplayed or denied the dangers, but DW's investigation reveals how it is contaminating the air in the Turkish city of Hatay.
Beneath the cloud of dust that covers the earthquake-hit city of Hatay in southern Turkey lies another danger: asbestos. DW reporters invited Utu Firat, an environmental engineer, to help them collect dust samples for asbestos analysis.
Anyone who has come into contact with Hatay is at risk of being exposed to asbestos.
The journey starts from Gaziantep, 200 kilometres away from Hatay, because the local airport was damaged in the earthquake. 7 months afterwards, the city still resembles a war zone.
We took dust samples near the tents where people live. We also went to an area where earthquake rubble had been piled and took various samples for asbestos analysis.
Asbestos can cause mesothelioma, lung and pleural cancer over decades. But constant exposure to contaminated dust can quickly lead to acute illnesses.
My brother got sick from the dust. We take him to the hospital and they give him oxygen. But then we come back here where the dust hurts him. Sometimes he sleeps the whole week.
According to public health experts, thousands of children in the region are at risk of developing lung cancer by the time they get to their 20s or 30s. This rubble dump is 50 metres away from containers where people live. Next to it is a high school with some 5,000 students.
Had asbestos materials been removed before the buildings were demolished, the dangers could have been minimised.
Locals said the government prioritised quick reconstruction over public health. After 2 days of reporting on the ground, the team is back in Gaziantep. They take one last dust sample from the roof of their car. The next day, the lab results show that asbestos travelled hundreds of kilometres with them on top of the vehicle. It's a clear indication of the extent of the danger, possibly affecting millions of people.
The results we received are really serious. We detected asbestos in 16 out of the 45 samples. That is why the statements made by the authorities do not reflect the realities on the ground.
A public health scientist also examined the lab report.
We may face the deaths of tens of thousands of very young people due to cancer. Official statements claiming that people aren't affected only results in covering up the problem.
The process of removing asbestos is costly and slow, but the Turkish experience shows how much more destructive asbestos can be if it isn't done, because when disaster comes, it'll be too late.
Let's explore this with Yasemin Didem Aktas, who is a structural engineer and associate professor at University College London. She is herself from Turkey. Welcome to DW. Asbestos in 16 out of 45 samples. What's your reaction to that?
I'm unfortunately not surprised at all, because we, as IFITs, we have been conducting our studies in the area since February, and we have been to the area on a number of occasions, and we have witnessed the demolishment and debris management practices in the area. And these are absolutely our observations. The dust is very prominent in the area where the demolishment is currently being undertaken. And it's really hard to breathe in the area. And we have spoken with a lot of people in the area who were complaining from the same things. We have discussed this with people who are living very close to the debris disposal areas, who, again, were very worried about their health and their children's health. So I definitely think that there is a very strong health crisis coming up.
Right, and it's interesting you say that it's hard to breathe anyway, regardless of the asbestos there.
Well, I mean, it's very dusty because the demolishment practices are not done in a way that actually takes any precautions in terms of the sort of dust, impacting the overall environment. In certain cases, you can see that they are using water to control the dust coming out of the demolishment areas, but this is not commonplace and definitely isn't sufficient to control the particulate matter that's going into the air during these practices. And after a few days in the area, we really found it really difficult to sort of breathe, and we were all clogged up. And just imagine people living in the area constantly.
But the government says it has taken necessary steps, and they're separating toxic materials before demolishing, and, as you say, using water to keep the dust down. From your assessment, it sounds like you either disagree or you don't think they're doing enough of it.
I disagree. Yes, it is true that there is water in certain places, but this is not everywhere. And the amount of water that is being used isn't stopping the particulate matter going into the air in large quantities. Also, again, we have spoken to a lot of people who are working in the debris management operations, the truck drivers, etc., and we have actually traveled with them. And I can tell you that the dust is everywhere, and it's not controlled in any form or shape, perhaps except very weakly during the demolishment stage. Another thing that attracted our attention is the choice of the debris disposal areas. These were, in often cases, very valuable agricultural lands and very close to water resources. Now, the literature is very clear that asbestos cannot dissolve in water, but it's still very expected that all the asbestos fibers are going to mix with the water, and that they can be carried, large distances with the water running around.
Thank you for talking us through that so clearly. Yasemin Didem Aktas, structural engineer from University College London. Thank you.
Thank you.